New and classic country, 93.9 WLVB with Lady Antebellum. Well, it's 8:19, and it's been a tradition with us here at WLVB. We've collaborated over the last several years with the folks with the Lamoille County Mental Health Services to recognize this month of May as Mental Health Awareness Month. And we've touched on a couple of topics already over the last couple of Wednesdays. And today we're talking Children, Youth, and Family Services. Christina Glowak, who is the Redwood Program Director. I'm going to let her explain what that is in just a moment. And Katina Idle, who works with Christina as a clinical coordinator. So, Christina, good to have you back again this morning.
Good morning.
And this has been a great series, and it's a great opportunity for folks to get a little bit of an idea about what Lamoille County Mental Health Services does, because you must still have people that still kind of question about, so what are some of the things you do over there?
Sure. So through the Redwood program, we are the behavioral interventionist program for Lamoille County Mental Health, and we work with the 3 surrounding school districts supporting children in the public school system. So our children could be as young as 3 and go all the way up to the age of 22, and we are supporting them in school, in the community, and also at work site.
In what ways do you support them? What are some of the things that you do?
Absolutely. So every child that comes into the program has a one-to-one behavioral interventionist who's assigned to work with them throughout the day, helping the children gain the skills that they need so they can eventually graduate from the program. And each case also has a service coordinator and a behavioral specialist connected to the kiddo.
The kiddo, yes. So how are the kids, and well, I guess when they're 22, I mean, they're almost like young adults at that point. How are they assigned and how are they implemented into the program?
Absolutely. So a school would identify that there's a higher level of support needed than what they're able to support within their current structure. So at that point, they would contact me in regards to contracting with our program to come into the school to support the child.
And of course, the Redwood program is one of many programs that kind of goes under the umbrella of Children, Youth, and Family Services. Then.
Yes, absolutely.
Well, right. Now, Katina Idle, we're going to have her come in here. She's here this morning as a clinical coordinator. So you work with Christina to an extent,
we
or
work
an
across
extension?
the hall from each
across
other.
the hall, okay. So as a clinical coordinator, what are some of the things that you do?
So Redwood handles a lot of the in-school services for kids with high-level needs. One of my jobs is to make sure that we also have a school-based clinician available to help support kids in school, just for some community supports, for some extra one-on-one time, maybe some groups. But then the other parts of our program are about how to help kids in the community, so outside of the schools. So we offer individual therapy, family therapy. We also offer skills work and case management, and some in-home based help too. If parents are looking for help with their kids in-home, how to set up schedules and support positive behaviors. So that's a big umbrella of what we do. We also handle kids that are in crisis. So if there are some things that are happening that are worrisome, you can call our crisis line, get connected that way, and we can do a big wrap service for kids that need a very high level of care. But hopefully, over time, with this kind of support, they're able to just kind of graduate down to maybe just some outpatient basis.
So is there any apprehension from parents in taking that first step? Is there always that
I think there is.
To identify, to actually admit that, there really is an issue.
It's hard for anybody to admit they need a little extra help. And there is a stigma about mental health. So I think part of this whole Mental Health Awareness Month is to help overcome that stigma. That learning how to regulate and control your emotions and your behavior can help you be a more successful human being. And there are a lot of reasons why we need a little extra support.
Right, and there's nothing wrong with admitting, that you have issues, because there are people of not only children but of all ages that maybe sometimes have a problem wanting to deal with it, but
not knowing how, or not even knowing that it's okay to admit that you might need a little extra help. I think we all do, which is part of living in a community. So how can we, as a community-based organization, help support everyone in the community?
And of course, it's an advantage actually to an extent that it is a smaller community too, that we're more like a family family oriented as compared to like maybe bigger cities where maybe you feel, because you see people all the time.
Yes, you do. I mean, I think this is a nice way to be able to work with each other, even though we have a very large area. We have a very large rural area that we cover. but we have a nice home base at Lamoille County Mental Health.
Right, exactly. Well, thank you, Katina. I want to bring Christine back in. Christine, I'm sorry, one more time, because you've got actually, under your program, you've got an event coming up later on this month you wanted to talk about.
Absolutely. So for Mental Health Awareness Month, Lamoille County Mental Health is going to be sponsoring a free training for the community. So we're going to be offering youth mental health first aid. It'll be on Tuesday, May 30th. And if individuals are interested in being a part of this free 8-hour training, they can contact the agency at 888-5026 to sign up. And individuals who attend this training will leave with a certification as a youth mental health first aider that will be valid for a 3-year period.
So what the types of people would want to be part of this program?
Absolutely.
Who would it be the most helpful to?
This training is available for absolutely everybody in the community. We've had parents, individuals who have worked at local banks. We've had individuals attend from churches. So it's really designed for community members and individuals who really want to learn more about supporting somebody who might be having a mental health crisis or experience. So it really is designed for individuals outside of the mental health field to come in and attend and really learn how to support a youth who's having a difficult time.
Yeah, not only supporting, but actually probably seeing it, actually, you know, to be able to visualize or be able to identify what the problem is. Because I guess sometimes you know there's a problem, but you just don't know the first step. And so it sounds like this course would kind of get you started in that direction.
Absolutely. It definitely builds confidence. We have lots of conversation. We do role playing and different activities. So there's absolutely the opportunity to practice the steps that we're talking about throughout the training.
Right. Okay. So that again is on May 30th, correct? Okay. And is there more information probably on your website, I would imagine?
Absolutely. Yep.
Okay.
www.lamoille.org.
Okay. And or if you want to find out more, if you want to talk to Christina about more, or even Katina, you can contact them right at the office, correct?
Absolutely.
And the number there is
888-5026.
Okay, and again, this is a part of our ongoing series throughout the month of May for Mental Health Awareness Month with members of the staff of Lamoille County Mental Health Services, including Christina Glowak and Katina Idle, who are here this morning. Thank you very much, and congratulations on the great work that you two do, but on what the whole organization does. You guys do fabulous work and continued success. And I look forward to next week when we'll be talking with folks next week from the Developmental Services Program as we continue for Mental Health Awareness Month. Okay, thanks very much.
Thank you.